Health is the foundation of development, and with the growing population in Maiduguri, the Borno state capital, the demand for healthcare services across all sectors has significantly increased. Governor Zulum has always prioritized projects that meet the needs of his people. It is against this background that the present administration constructed many hospitals in the state capital to ease access to efficient and effective healthcare services. Residents of Garnam, Zajeri and other surrounding communities in Bolori to Maiduguri metropolis have seen light at the end of the tunnel, as the Brigadier Abba Kyari Memorial Hospital, previously an infectious diseases center, has now been remodeled, re-equipped and upgraded to a world-class general hospital. During the inauguration of the newly upgraded hospital, Governor Babagana Umara highlighted a significant transformation. Recognizing the needs for advanced medical infrastructure, the government undertook a major upgrade, equipping the hospital with state-of-the-art healthcare facilities. This revitalized institution will now serve as a modern healthcare hub, ensuring quality medical services for the people of Maiduguri and reinforcing the state's commitment to improving public health.
The place is back and we had the opportunity of having another infectious disease hospital constructed by the NNP. We decided to remodel this hospital and then converted it into a general hospital because this area doesn't have as a hospital. In addition to this, another wing was constructed comprising of about 50 beds to take care of the maternity section, maternity and child section. So this hospital is a modern hospital, expanded hospital to take care of this area which has no access to affordable healthcare delivery system. On this note, may I invite the minister, the coordinating minister of health to commission the modern general hospital.
I want to thank you for this and we want to award you. Go ahead and commission this. Hereby, commission this Abba Kyari General Hospital in the glory of God, for the benefit of all prostate, of Nigeria and humanity overall, and may God help us. Thank you.
During the commissioning of the edifice, the coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, commended Governor Zulum for his substantial investment in the healthcare sector of the state. He particularly praised the governor's unwavering commitment to improving the well-being of the people, highlighting the significant financial resources he has dedicated to public health initiatives.
Thank you, all of us, not only here in the state but also in the entire office, for this amazing work of transforming this magnificent building into the Abba Kyari General Hospital here in the what we have heard will be highly impactful effort that will help drive maternal mortality. I'm very much aligned with the President's direction as well, that we work together with you. We want to thank you for this and may God reward you.
Furthermore, Professor Pate emphasized Governor Zulum's proactive measures in combating maternal mortality, noting the remarkable progress made under his leadership in reducing deaths related to childbirth. He reaffirmed the unwavering support of the federal government in ensuring the success of these critical interventions, expressing confidence that, with sustained collaboration, even greater achievements lie ahead of the people of Borno State. The 150-bed capacity General Hospital is designed to enhance healthcare delivery in the surrounding communities. This edifice has various departments and units such as Accident and Emergency, General Outpatient Department, Radiography, Maternity and Baby Care sections, as well as Pharmacy, theatre and laboratory for diagnostic testing, among others. All these departments have been equipped with cutting-edge facilities for effective service delivery. Elaborating on the government's decision to undertake the remodeling and expansion of the hospital, Professor Baba Malam Gana emphasized that the initiative was designed to significantly improve healthcare accessibility for surrounding communities. By upgrading medical facilities and increasing capacity, the project aims to directly combat the persistently high maternal and neonatal mortality rates in the state, ensuring safer deliveries, better postnatal care, and overall enhanced healthcare outcomes for mothers and newborns.
I want to begin by appreciating the Creator, Allah subhanahu wa ta'ala, and followed by His Excellency Governor Babagana Omar Zulum, the compassionate governor, the people's governor, Borno State. He has put the health care of citizens of Borno in his mind, and is slowly getting there in terms of universal healthcare coverage. The hospital that has been remodeled used to be an infectious disease hospital during the COVID period, but thereafter this has now been modified to serve as a general hospital, because that axis of Borno or Maiduguri hasn't got secondary care facilities, and this facility now has can boast of 2 operating theaters, one for general surgery and the other one is for cesarean section. It has got diagnostic, it has got outpatient, inpatient laboratory complex, and also maternity complex. So that will tally very well in terms of maternal mortality reduction in the state, especially in Maiduguri, with its high population, and in that way then we can help mitigate this maternal mortality, not only in Borno State but Nigeria in general. It has also got a pediatric or neonatal unit, which will help mitigate the newborn death in our society. Nigeria ranks second to India in terms of newborn death in the whole world. So this will help us greatly.
The Permanent Secretary of the Ministry of Health, Dr. Shetima Maina Mohammed, and the Chief Medical Director of the Hospital Management Board, Professor Abubakar Kulima, applauded Governor Zulum for always supporting the healthcare sector and enumerated the services the new facility will offer to the immediate community.
2 very historic events took place this morning. His Excellency Executive Governor of Borno State accompanied the Honorable Coordinating Minister of Health to commission the remodeled and expanded Brigadier Abba Kyari Memorial Hospital. Now, this hospital was previously an isolation center, but he invested a lot of funds and renovated it, expanded it to be a fully equipped hospital that would serve the residents of Bolori to Maiduguri, which is a very densely populated area. Hitherto, this kind of facility is lacking in this area. So it will serve to, it has a maternity section that has about 50 beds. Now this will also serve pregnant women. It will lead to reduction of maternal mortality, and there are child health facilities there, fully equipped. So it is a very historic event.
The 2 important projects that were commissioned this morning, the remodeled Brigadier Abba Kyari Memorial Hospital is one of the general hospitals that were situated in one of the most densely populated areas of Maiduguri Metropolitan Council. If you look at it, the closest facility to people of this community is State Specialist Hospital Maiduguri, which is almost about 5 to 6 kilometers away from here. And this Boloritu is one of the second largest wards in Maiduguri Metropolitan Council. And so siting this hospital in this particular location will greatly assist in providing quality healthcare services to the people of this community, to make it accessible and easy to reach location. So this is the importance of siting this. And that goes to show that at least people in needs of emergency need not to travel long. They can easily access at their doorsteps. And you can see the hospital is surrounded by virtually, you can see some houses around this area that are surrounding this place. So they can easily access services, both in terms of maternal as well as other general services.
Similarly, the Executive Governor of Borno State, Professor Babagana Umar Zulum, alongside the Coordinating Minister of Health and Social Welfare, launched the brand new ambulances for Borno State Medical Emergency Treatment and Ambulance System, SEMSAS. In his address, Governor Zulum emphasized that these ambulances are provided to strengthen emergency services.
Ambulances are only for Metropolitan Council. Everybody is there. So the center is there, the kids are there, the drivers are there, the code numbers are there. Whenever the less privileged people are in need of support, they will call it so that the ambulances will take the women that are needed to be transported to the hospital on time. We have many local government areas, the Borno State government has ambulances all over, and we are willing to provide more ambulances at the local government area. On this government in mind, commission is taking ambulances for emergency referral systems within Metropolitan Council only.
Your Excellency, I think this is an excellent effort by your government. We thank you. On behalf of the Federal Ministry of Health and the Federal Government, I assure you that I will meet you up on this. Requested rest-smart tricycle ambulances. We have taken note of that, and I assure you that we will provide some of the tricycle ambulances as soon as they deliver, so they can extend and complement what you are doing in the rural areas. Alongside the MAMI initiative, the reimbursement for ambulance services also will cover some of the services that we provided with these ambulances that you have provided. So with those remarks, I hereby commission these ambulances for the benefit of all the citizens of Borno State and to the glory of God, and may God help us all. Thank you. Thank you, Excellency.
The Commissioner of Health, Professor Baba Malam Gana, spoke on the significant impact SEMSAS could have in reducing maternal and neonatal mortality rates in the state.
Emergency and ambulance services system called NEMSAS, and by so doing we have created the SEMSAS, which is State Emergency Medical and Ambulance Services. This particularly is aimed at reducing the delays of pregnant women getting into healthcare facilities, especially within metropolis. For example, if a pregnant woman bleeding about 1 o'clock in the morning, she has no any transport in her family, then it's a tall order for her to survive. But with this system of emergency transportation, especially for pregnant women who are sick or newborn, then we can be able to transfer this patient quickly and and be treated in the hospitals. So if she needs cesarean section, then that will be carried out promptly and save both the lives of the woman as well as that of the newborn. So it's really for me it's an immense pride that we have attained this level of healthcare in Borno State, and in that way it's not just the pregnant women but also emergencies, accidents. These emergency centers have got call numbers which we will provide eventually, is 112 numbers, and therefore it's toll free, it's free to call these centers, and the ambulance will come to the homes of the patients and pick them up, especially pregnant and sick newborns, and if it's accident, from the scene of the accident, and deliver the patients to the hospitals. This is what it takes, and this is a revolution in Borno State. This has not happened before, and we're very grateful to His Excellency for this innovation of having emergency ambulance system in the state with toll-free numbers.
The Permanent Secretary of the Ministry of Health, Dr. Shetima Maina, and the Chief Medical Director spoke on the significance of Borno State Medical Emergency Services in the healthcare sector.
Now, the second important occasion that took place was the commissioning of 10 ambulances for the state emergency medical ambulance system. This is a phenomenal development because now these vehicles will convey pregnant mothers to nearby health facilities whenever they are called. So it will assist them. It will reduce the delay time from transportation from their homes to the health facilities, thereby reducing mortality and also saving neonatal lives. That is, the inborn children will survive. So honestly, we will continue to express our gratitude to His Excellency. We cannot thank him enough because he has done unprecedented reform of the health sector of Borno State. With these innovations, definitely the Borno State health sector that has never seen before, the health sector has greatly improved.
The emergency ambulance service that was launched this morning, this is one of the directives from the Federal Ministry of Health for states, to adapt the national emergency, ambulance services, and it is in line with this. His Excellency graciously procured these ambulances for us to kickstart the activities, and it was observed that ambulance will play a very key role to ensure that at least sufferings by women which are prevented from happening. So in view of this, these ambulances were procured, and then women who are in need of emergency services can easily access these services even in the late hours, so that they can have services for them to, easily reach the hospital. So it was in that directive His Excellency procured this ambulance for use by emergencies. People in the comfort of their houses, they can call the toll-free line, and then these ambulance services will reach wherever they are, and they can pick them, to the hospitals. And equally from this hospital, if they need referral to other facilities, they can also be taken. So these ambulances have access and they have connections with most of the hospitals around. So that not necessarily this hospital, any hospital around within Maiduguri Metropolitan Hospital, these ambulances can reach, depending on the proximity of that patient to, the respective facilities that are spread across all the four corners of Maiduguri Metropolitan Council and Jere.
Community members also shared their thoughts on this important project cited in their area.
Alhamdulillah, abinda zamu ga gwamna Zulum da farko mun gode Allah madaukakin sarki da Allah ya karkato da hankalinsa ya mana wannan asibitin, wanda asibitin da muna tsammani babu shi a Abuja ma, balle gashi a Balortu a kofar gidanmu a gidanmu. Mu abinda zamu faɗa mai girma gwamna sai dai Allah saka mana alkhairi, Allah ya ƙara arziki kuma ya sake shiga Balortu ya sake mana gyara fiye da haka. Ai da ba asibitin nan muna shan wahala. Za mu tashi daga nan zuwa janar a ce ba dabte ba waye muna shan wahala, amma yanzu mai girma gwamna ya kawo mana abu hancin mu da tsakiyar mu wani gari muke ji yau ko a America wannan asibitin ya kace, saboda haka mu ba abin da zamu ga gwamna sai dai Allah saka mar kuma ya sake shigowa Bolortu ya sake gyara fiye da haka, mu kuma zamu mar fiye da haka addu'o'i kan muna mar dama
aro kujin da zo rura bana umara zulmu taida nya askara da fale da kalare tariyala cinyayya da tariga na kaskata wahala yayin amma kuro sukur tun da nguron da ya dawo nguron da ya lafurin zuna da tsawo karon da kaje kamuwa ta da kwanga ga na kura san maso shiro godiya tunai murna dena kaman da alasa ya barazu hutu da na ndiyar sunna da jikin zai fandena ritari fandena kuruna fandena dokta fandena ta yi idanye godiya dena ala andira shakonza ala sha barazu.
A gaskiya na farko zamu gode wa Allah mu mutanen Boloritu ba abin da zamu giya gwamna sai dai mu gode marmaci Allah ya saka mar da kuma Lawan wanda matashi ne yana da zuciya da farko a angonmu abin da ya kama Boloritu kap wahalan aihuwa mace za ta tashi daga nan sai an je asibiti kuma daman a yanayin insurgency wannan ya zamanto cewa ba waje isasshen gadaje, amma da Allah ya kama mana mai girma gwamna ya zauna ya duba ya ji kukanmu kuma ya zo yau kan ina gani ba Boloritu ba ga baki ɗaya NMC ma za su iya su zo asibitinmu na garin nan don ba wai sai an gaya muku ba da ku da kanku in kuka juya ba kuka ga asibitin kun san cewa asibiti ne ba na wasa ba, asibiti ne wanda aka yi shi da gaske kuma an sa equipment na zamani.
Muna gode mishi da farko gaskiya ya yi kokari ya duba ya yi abin da ya kamata. Mutumi ne mai hankali, mai tunani, mai fadakarwa, ya san me yake yi. Ya yi mana abubuwan da mutum in ya gani gaskiya ko patient ne ya zo asibitin ya gani ba zai so ya tafi ba saboda ana kula da shi.
Governor Zulum is always passionate about the well-being of his people, and the Ministry of Health is working around the clock to complement the governor's effort in making Borno great again.